Now joining us to discuss maternal health and family planning is Dr. Catherine McCaig. She is Chief of Family Planning for JPIGO, an international nonprofit organization affiliated with Johns Hopkins University in Baltimore, Maryland, that's working to break down barriers to high-quality health care for the world's most vulnerable populations. Dr. McCaig, welcome to the program.
Thank you. It's very nice to be here.
Now, maternal health and family planning are some of the issues that your organization really works on, especially in sub-Saharan Africa. Tell us about what you're doing, some of the elements, key elements of your work.
Okay. At JPIGO, we see maternal health and family planning as being inseparable, really. We work in a very integrated systems approach to women's health, which includes prevention of postpartum hemorrhage, so the piece we just saw. It's a systems approach, works with building the capacity of health workers as well as community members as well to provide comprehensive maternal health care as well as newborn care as well as family planning, which is also an essential element.
And speaking of family planning, we hear that it's a very important aspect of ensuring safe motherhood. But a lot of time we have the tendency when we hear family planning to think of either birth control or reducing the number of children that a family can have. Tell us about some of the key issues, key aspects of family planning.
I'm really glad you asked me that question. I think this is one of the most misunderstood areas of family planning, is that it's for population control or to have women limit the number of children. Really, it's about choice to have baby when you want to have it, when you are ready for the baby, and also for spacing, to ensure there's an adequate space between pregnancies. We see many morbidities that are associated with closely spaced infants, so family planning really gives women an option of determining how many children to have and when to have them. So deciding with their families what they want to do and when they want to have their children.
Now, how do you address this issue in an area like sub-Saharan Africa, where women have the tendency to have many children? I know my grandmother had 13 children, my mother 7. So it's something that is very common. How do I address that to convince them that they really have to get started with family planning?
Well, I think in our experience, many women are already convinced in that, you know, maybe they have reached the number of children that they want to have, so that they're really interested in long-acting methods that might allow them to maybe not have more children, but also to space their children, to provide more time between pregnancies. So I think that many women are already convinced, but there are problems with access. There's problems with women understanding about fertility return issues, about when they are vulnerable to pregnancies. So as a comprehensive approach, information, counseling, and particularly integrating family planning services within maternal health care services is very important, because family planning is a life-saving intervention.
Absolutely, and that's all the time we have today, Dr. McCaig. We hope to have you back very soon to continue this conversation.
Thank you.
And that was Dr. Catherine McCaig. We thank her for joining us, and back to you, Dimiake.
Well, thank you so much, Leno, for that very important and informative segment. And of course, for our audience, please remember to join us every Tuesday and Thursday, where Leno is always here with the latest health news in Africa.